This episode, we will be talking about malaria. Malaria is a serious tropical disease that occurs in more than 100 countries and territories. Malaria occurs mostly in poor tropical and subtropical areas of the world. Since malaria affects such a large part of the world, with almost half of the world's population in risk, we thought it would be very fitting to do a video on it.
So, what are the causes of malaria? Malaria is caused by the Plasmodium parasite. This is a parasite that is spread to humans through the bites of infected mosquitoes. There are many different types of Plasmodium parasites, but only 5 types of parasites cause malaria in humans. These are Plasmodium falciparum, which are mainly found in Africa, and it is also the most common type of malaria parasite and is responsible for the most malaria deaths worldwide. Plasmodium vivax, which is mainly found in Asia and South America. This parasite causes milder symptoms than Plasmodium falciparum, but it can stay in the liver for up to 3 years, which can result in relapses of symptoms. Plasmodium ovale, which is an uncommon parasite and is usually found in West Africa. It can remain in your liver for several years without producing symptoms. Plasmodium malariae, which is quite rare and is usually found in Africa. And finally, Plasmodium knowlesi, which is very rare and is found in parts of Southeast Asia.
How is malaria spread? The Plasmodium parasite is spread by the female Anopheles mosquitoes that most commonly bite between dusk and dawn. Once you're bitten by a mosquito infected with malaria, the Plasmodium parasite enters the bloodstream and travels to the liver. The infection develops in the liver before re-entering the bloodstream and invading the red blood cells. The parasites grow and multiply in the red blood cells. At regular intervals, the infected blood cells burst, releasing many more parasites into the blood. These infected blood cells usually burst every 48 to 72 hours, and each time they burst, those infected with malaria will have bouts of fever, chills, and sweating. Furthermore, if a mosquito bites a person already infected with malaria, it can also become infected and spread the parasite on to other people, increasing the transmission rate of malaria. However, malaria can't be spread directly from person to person. On the other hand, malaria can be spread through blood transfusion and the sharing of needles, but this is very rare.
So, what are the symptoms of malaria? Typically, the symptoms of malaria start 7 to 18 days after being infected, depending on the specific parasite you're infected with. However, in some cases, it can take up to a year for symptoms to develop. The initial symptoms of malaria are flu-like, which include a high temperature of 38 degrees or above, feeling hot and shivery, headaches, vomiting, muscle pains, diarrhea, or generally feeling unwell. These symptoms are often mild and can sometimes be difficult to identify as malaria. With some types of malaria, the symptoms occur in 48-hour cycles. During these cycles, you feel cold at first with shivering. You then develop a high temperature, accompanied by severe sweating and fatigue. These symptoms usually last between 6 and 12 hours.
Anti-malarial medication is used to prevent and treat malaria. You should always consider taking anti-malarial medicine when traveling to areas where there's a risk of malaria. This is because they can reduce the risk of malaria by 90%. Just like any other prescription, it is also very important to take the correct dose and finish the course of the anti-malarial treatment. There are many different types of anti-malarial tablets, but you will be prescribed them based on the following information: where you're going, any relevant family medical history, your own medical history, including any allergies to medication, any medication you're currently taking, any problems you've had with anti-malarial medicines in the past, your age, and whether you're pregnant. Those being prescribed the anti-malarial medication may also take a short trial course of anti-malarial tablets to identify any adverse reactions or side effects, as alternative anti-malarials can be prescribed instead.
The main types of anti-malarials used to prevent malaria are Etervicone plus proguanil. This medication shouldn't be taken by pregnant or breastfeeding women due to a lack of clear research and evidence. It is also not recommended for people with severe kidney problems. The possible side effects of this medication are a stomach upset, headaches, skin rash, and mouth ulcers. Furthermore, this anti-malarial medication is more expensive than other anti-malarials and so isn't suitable for long-term use. Doxycycline, also known as fibromycin D, which is not normally recommended for pregnant or breastfeeding women, children under the age of 12, or people with liver problems. The possible side effects for this medication are stomach upset, heartburn, thrush, and sunburn as a result of light sensitivity. However, it is relatively cheap, and you can also take doxycycline for acne, which will also provide protection against malaria, as long as you're taking an adequate dose. And finally, we have Mefloquin, also known as Lariam, but it is not recommended if you have epilepsy, seizures, depression, or other mental health problems, and is not usually recommended for people with severe heart or liver problems. The possible side effects are dizziness, headache, sleep disturbances, and psychiatric reactions.
When it comes to treating malaria, if it is diagnosed and treated promptly, a full recovery can be expected. Treatment should be started as soon as blood tests confirms malaria as a form of diagnosis. Many of the same anti-malarial medicines used to prevent malaria can also be used to treat the disease. However, if you've taken the anti-malarial to prevent malaria, the same one shouldn't be taken to treat it. Anti-malarial medication is usually given as tablets or capsules. If someone is very ill, it will be given through an IV drip into a vein in the arm in hospital. Treatment for malaria can also leave you feeling very tired and weak for several weeks.
Complications of malaria. Malaria is a serious illness that can be fatal if not diagnosed and treated quickly. Pregnant women, babies, young children, and the elderly are particularly at risk. The complications of severe malaria can occur within hours or days of the first symptoms, causing it to easily become fatal. The complications of malaria are anemia, as the destruction of red blood cells by the malaria parasite can cause severe anemia, which is a condition where the red blood cells are unable to carry enough oxygen to the body's muscles and organs. This would leave the affected feeling drowsy, weak, and faint. Cerebral malaria, which is when malaria affects the brain. It causes the brain to swell and sometimes leads to permanent brain damage. It also causes fits or coma. The other complications are liver failure and jaundice, shock, which is a sudden drop in blood pressure, pulmonary edema, which is the buildup of fluid in the lungs, acute respiratory distress syndrome, or ARDS for short, abnormally low blood sugar, kidney failure, swelling and rupturing of the spleen, and dehydration.
Prevention. Since there's a significant risk of getting malaria if you travel to an infected area, it's very important you take extra precautions to prevent the disease, apart from just using anti-malarial medicine, as they only reduce the risk by 90%. Therefore, malaria can often be avoided using the ABCD approach to prevention, which stands for A, awareness of risk, where you find out whether you're at risk of getting malaria; B, bite prevention, where you avoid mosquito bites by using insect repellent and using a mosquito net; C, check whether you need to take malaria prevention and tablets; and diagnosis, which is where immediate medical advice should be sought if experiencing malaria symptoms.
Why is malaria so common in tropical and subtropical regions of the world? Well, the reason for this is that in these regions, a very efficient mosquito called Anopheles gambiae complex causes high transmission. Local weather conditions often allow transmission to occur year-round, and scarce resources and socio-economic instability have hindered the treatment of this disease.
Malaria can be a fatal disease. However, the recognition and support needed to fight malaria isn't being met. As Dr. Robert Newman, the director of the Global Malaria Program at the World Health Organization, said, getting people to pay attention to this problem, to the fact that fighting malaria isn't all about bed nets, isn't easy. Therefore, after watching this video, we hope that we have left you with more knowledge about the disease.
Thank you for watching. Make sure to like, comment, and subscribe to see more videos from us in the future. Also, make sure to check out our blog and our socials in the link down below. Once again, thank you for watching.